Great variation in breastfeeding practices both currently and in the past exists between cultures. Their functionality in terms of either maternal or infant survival is not always optimal or perfectly compatible with the environment or living conditions. At least since the antiquity, discussion of proper breastfeeding customs has occasionally emerged. The beneficial qualities of mother's milk were acknowledged, and much like the current recommendations, in the past, full breastfeeding was typically encouraged. Breast milk was not only considered the most natural nutrition for infants, but also an effective remedy for older children and even adults. Mothers were seldom discouraged from breastfeeding. Nevertheless, as syphilis, by then known to be contracted through breast milk, was spreading in post-medieval Europe, using animal milk instead was promoted. Various beliefs have guided the customs connected to this natural method of feeding newborns. For instance, the deep-rooted belief that colostrum was dangerous and thus to be avoided prevailed for centuries in many cultures, among others until the mid-18th century in Western Europe. Sometimes breast milk was instructed to be discarded for several days after birth, and to be supplemented by, for example, sugar water. Nowadays, it is known that colostrum is crucially important for the early development of immune system in a transition from the near-sterile uterus to outside environments. What is more, the character of the nursing woman was believed to transfer to the child through breast milk. This called for deliberation in terms of both physical and mental condition when selecting the wet nurse, if such was required. In some cultures, it was even believed that the human sin was contracted through the medium of mother's milk. Under certain conditions, breastfeeding was considered improper. For example, menstruating as well as a new pregnancy were for a long time thought to spoil the milk. What is more, intercourse during breastfeeding period has widely had a taboo nature. Particularly, the latter may have tempted the fathers to object to very long breastfeeding periods. Despite the official encouragement, in the past, breastfeeding, at least in the extent currently and then recommended, is known to sometimes have been avoided out of vanity but also necessity. Malnourished mothers may have been faced with serious health problems, as their bodies struggled to provide for the required nutrients to produce milk, a situation which would have left both the mother and the baby in trouble. Even childbed mortality was high at the time, and in cases where the mother died or was unable to breastfeed, for example due to being seriously ill, the child needed to be kept alive in alternative ways. Generally, breastfeeding was not completely acceptable behavior for upper-class women. Wet nurses were commonly employed and exploited, at least since the antiquity. But curiously, using their services was still widely disapproved. By the early modern period, quite blooming line of business had evolved around wet nurses, which did not solely concentrate on the well-being of children. Instead, many tricks of the trade would endanger the infant's health in serious ways. It was common for young poor women to get pregnant and simply get rid of their own babies in order to find well-paid positions as wet nurses in wealthy households. Many poor Finnish women from nearby regions of St. Petersburg left their families and babies for a paid job as a wet nurse. In fear of losing their positions, wet nurses sometimes failed to inform if they had dried up, which led to the infant not being fed properly. So this practice left both the wet nurses' own infants and their fosters in danger. The isotope signals derived from the wet nurses as opposed to the infant's own mother's milk cannot be distinguished. Yet they would indicate very different parental attitudes. Most individuals in the sample I use likely represent the common people, which decreases the likelihood of breastfeeding having been performed by someone other than their own mothers. Nevertheless, since the late 18th century in Europe, use of wet nurses became more common among the less wealthy, as mothers needed to contribute in family finances by seeking employment outside homes. On the other hand, since the 18th century, the attitudes among the elite began to change. Breastfeeding was introduced as a natural and moral duty of mothers. However, in the 18th and 19th centuries, weaning very young infants was still a popular practice, for example, in the Ostrobotnian towns. Breastfeeding is time-consuming. Still today, short maternal leaves and inflexible working hours discouraged mothers from breastfeeding their infants. Thus, instead of personal choices, infant feeding practices are often shaped by prevailing norms, regulations, and opportunities. In early modern and modern Swedish ironworks communities, the wives did not work but instead had time to breastfeed their children, which was reflected in lower infant mortality. In contrast, in the countryside, especially in summertime, mothers were required to labor on the fields. In the Ostrobotnian countryside, the men typically spent weeks working far from their home farms. In the meantime, their wives took care of the farms, and it was common for the mother to return to the field just a few days after giving birth. All the able-bodied members of the family worked. This meant that the babies were left in the care of their small siblings or frail grandparents, or even on their own with just a feeding horn. Milk was poured into a carved-out cow's horn with a small hole at the pointed end. The horn was placed hanging above the crib, and milk was slowly dripping through the hole into the infant's mouth. During the working days, the milk provided by the horn often spoiled. The horn was seldom cleaned with much else than water. Instead of mother's milk, it could contain that of cows. Foods even less suitable for infants, such as cereal-based gruels, were served using such horns. It is easy to understand that this would have been a much easier option than to preemptively milk the mother. Gastrointestinal infections were a common cause of infant mortality. Late summers were particularly dangerous for the farmers' children. Bacteria proliferated in unboiled water and sour milk. In the death records, the infants who died during the summer months of gastric flus after their first few weeks can with some certainty be identified as those not breastfed properly. Infants who died earlier than that were more likely generally weak as a result of unrelated factors. What is more, a certain portion of each generation was lost for such children's diseases as smallpox, measles, and whooping cough. But these mostly threatened the lives of slightly older children.